And now on the line is Siobhán Maher. Siobhán is the National Coordinator of DRIVE, which stands for Drug Related Intimidation and Violence Engagement. Siobhán, welcome to Near FM.
Thanks, Darren.
Siobhán, can you start off by telling our listeners who are DRIVE and the work that you do with them, please?
Sure, yeah. As you said, DRIVE, it stands for Drug Related Intimidation and Violence Engagement, and it's a national interagency project that has systems and structures to respond to drug-related intimidation and violence across the country. I suppose it's important to say the key objective of DRIVE project is to build the capacity of communities around Ireland to support victims of drug-related intimidation and violence. We build the capacity of services so they can then in turn support victims of drug-related intimidation. And we do this through training, resources, signposting victims to drug-related intimidation, specialist support services in their area.
And can you tell me who are your stakeholders that you work with?
Sure, yeah. I suppose it's important to say the DRIVE oversight, DRIVE project itself is overseen by the DRIVE Oversight Committee. And as I said, it's an interagency project. So it's important to say that the Oversight Committee is made up of a few different interagencies. For example, we have representatives from the Department of Justice, the Garda National Drug and Organised Crime Bureau, Probation Service, the National Voluntary Drug and Alcohol Sector, the HSE, the National Addiction Advisory Governance Group, the HRB, which is the Health Research Board. So it's really, really important to have those stakeholders working together, and they are the DRIVE Oversight Committee that oversees the DRIVE project.
And when you're working yourself on the ground, you do a lot of work with the drug and alcohol task forces, do you?
I work with the drug and alcohol task forces throughout the country. There's 24 in total. And each drug and alcohol task force has nominated a DRIVE liaison person. And in each area, as well as the DRIVE liaison person, there's a nominated drug-related intimidation inspector also. So each task force area, as I was saying, the whole DRIVE project itself, it's task force led. And each task force has a liaison person and a nominated drug-related intimidation inspector in their area as well. So I work closely with the DRIVE liaisons.
And you personally, you're based in Sligo, are you?
No, I am based in North Dublin.
Okay.
So I'm employed by North Dublin Regional Drug and Alcohol Task Force.
Oh, no, I just made a mistake. I was looking at the wrong task force last night, sorry. Okay, Siobhán, I did an interview with Maria Power from the Western Region Drug and Alcohol Task Force last month about a webinar that they had on the issue you work on. And indeed, Maria is the person who put me in touch with you so that we can do this interview today. I've also read a few big newspaper articles in the last few years on the issue of drug-related intimidation in Ireland. I was a teenager in the mid to late 90s, Siobhán, but back then I had some knowledge of the drug scene in Ireland, at least in relation to a couple of drugs. The issue of drug-related intimidation really is a big issue to a lot of people, and I could be wrong, but I believe that it has really grown a lot over the last 20 years. Is this the case?
Well, we are, we do know it's manifesting itself more and more. It's a very serious problem across the country. It's an insidious problem also, and it's affecting, as you say, individuals, families all across the country. It's very complex. We're hearing more and more how people, individuals and family members are living in fear, living with high levels of stress and anxiety, not knowing, I suppose, that they can access help and support. But yeah, we are hearing more and more, and that's why the DRIVE project needed to address the issue of drug-related intimidation because it is a very complex issue.
But what these individuals and families go through, being the victims of drug dealers, they really go through hell, don't they?
They can, yeah. We hear it manifest itself in various different ways. We hear reports about threats of violence, actual violence, damage to properties, damage to homes, sometimes sexual violence or threats of sexual violence. There's lots of different ways that it's manifesting itself. We hear about young people being targeted and recruited into selling drugs, being enticed into criminal activities by criminal networks. I could speak all day, Darren, about the different things that we're hearing. Families being targeted to pay drug debts and drug debts being taxed. So that's where drug dealers will just pluck figures out of the air, if you like, to increase the amount that they're intimidating that family for. Elderly people being targeted to pay drug debts for their grandchildren. And then people are struggling to pay these debts. They're using life savings. They're trying to access loans from family members, from credit unions. We've heard of people remortgaging their homes, selling their homes, relocating to different counties, trying to escape intimidators. So yeah, it is quite horrendous at the moment. So that's why we feel the need to do something about it.
And just is there much that yourselves and Drive and the task forces and the Gardaí can do about it, do you think?
Absolutely. And you see, the thing is, people don't know that there is support available. So I'm really glad that I'm able to do this interview with you today, because even if there was one or two people listening today and they can relate to what I'm saying and maybe they're experiencing drug-related intimidation, it's important for them to know that there is services, there's specialised services available through family support services, through drug and alcohol services, and also with the drug-related intimidation reporting program. And what that is, there's specialised nominated drug-related intimidation inspectors in each Garda division throughout the country, where somebody, if they wanted to speak to a guard, they could. And that could be done in an informal conversation or a formal conversation. But the person that's experiencing drug-related intimidation needs to know that they don't have to speak to the guard if they don't want to. There is still supports that are available, confidential supports, where they can speak to a family support worker or where they can speak to a drug and alcohol service frontline worker.
So
there are available support.
So if anyone's listening and they're going through what we're talking about, the best bet for them would either be to contact the Garda liaison officer or the drugs and alcohol task forces, would it? The
best way for if anybody is listening and they're experiencing drug-related intimidation, first and foremost, I know it can be very scary to reach out and access support, but when a family member or an individual experiencing drug-related intimidation does reach out and access support, it can really, really help. If they are experiencing, no matter what part of the country they're in, they can access a list of safe, free, confidential services and supports available in their own area on the website, and that's www.DriveProject.ie. As I said, there's a liaison. There's a liaison in each task force area. There's a nominated Garda and nominated inspector, a nominated drug-related intimidation inspector within each Garda division also.
Okay, Sean, I just have a couple more questions. Are you happy with how serious your stakeholder members in Drive are taking the issue of drug-related intimidation across the country, Siobhán?
Absolutely. It's a new project. It's actually getting to a very exciting point of the project where we're going to be rolling out training, where every frontline worker in the country will be able to access the training, so they will feel confident when they're working with victims of drug-related intimidation. There is going to be a national awareness campaign. So, yes, in answer to your question, absolutely.
Okay, before you go, can you tell me a bit about the national awareness campaign?
I don't have an exact date, but we are working with the company that we're developing the national awareness campaign with. So that's going to be in the next couple of months, and that is going to be alongside the rollout of the training as well.
Okay.